I usually make videos about religion, and that is a very important topic. But I'm also a physician, and I wanted to dispel some notions that people may have about the coronavirus. I see a lot of things from Facebook and government, actually, that is just simply misinformation. What I see the most is people comparing it to the flu. Is this your average flu? No, it is not. It is much worse. The fatality rate for your average yearly flu is less than 1%. From Chinese data, and what we're seeing in Italy right now, this particular virus, the coronavirus, death rate is at about 2.3%. A more important statistic is how often does it make people sick enough to where they require ICU. And this is important because of the issue of capacity. From Chinese data, from what I've been reading, that's at about 5%. And this is ICU admissions, not just general hospital admissions. There's also people, and I forget, I think it's about 8 to 12% of people that actually require hospitalization. You know, supplemental oxygen and stuff like that. So this is much, much more serious than the flu. It is more transmissible than the flu, and is more deadly than the flu. And that's the issue with it. You know, it's transmissibility. Ebola is much more deadly than this. Much more deadly than this. But it's not as easily transmitted as this. It's not as contagious. So because because it's so contagious and because it's so deadly, it is much worse than the flu, and it's actually theoretically much worse than Ebola, because Ebola you actually can isolate it, not easily, but you can isolate it. Every single Ebola outbreak was contained regionally. This has not been contained regionally, obviously. So how widespread is it? It is probably much more widespread than we know. The issue is, at least here in America, is testing. We cannot test anybody for it. Well, we can't test some people for it, but in the state of Illinois, where I work, through my conversation with the health department yesterday, March the 11th, the health department only had 3,000 tests for the whole state. Private labs are now getting the capacity, so LabCorp is getting the capacity, but all that is still very low, and at this point they want to keep those tests for more serious cases, which in my opinion does not make sense, because more serious cases are hospitalized. You can kind of get a clinical picture of what they have, and it won't change treatment. They're still going to require respiratory support. It won't do anything. The reason why we need to test is so we can try to contain clusters, so we can try to contain and isolate people. That window is quickly fading, and I think it probably is already faded. So what we can expect is, once we get the capacity to start testing, that we are going to experience what Italy has experienced. Exponential growth. You're not going to go from 1 to 2 to 3. You're going to go 1 to 2 to 4 to 8. Like that. You're going to have hundreds of new cases overnight. That's why it's so dangerous. That's why the testing was so important, and the government really screwed up the testing. So we have a serious risk of ending up like Italy. So how big of a risk is that? Well, we have limited capacity. That's the problem. And once people start getting very sick, if this gets super widespread because we did not test and we did not contain in the community, the people that get super sick, because such a large proportion of people could get very sick, we could quickly run out of capacity. You know, the difference between a critically ill rate, 5%, and the death rate, 2.3%, is our ability to treat them. So ventilators, medications, things like that. We have about 100,000 ICU capacity right now in the United States, and that's 2015 statistics that I was able to find. It might be more, it might be much more, although I seriously doubt it. That if we look at the death rate, we need 4 million infections to reach our capacity in a nation of nearly 400 million. So it is very serious. It is very serious. And Italy is experiencing this. So that's what we need to keep in mind. We should expect what they are experiencing, and they are running at capacity already. They didn't close down the country for no reason. They closed down the country because they're running out of capacity. They have to control the spread of infection. The Chinese did not make a hospital in 10 days because they were bored. They ran out of capacity. And this is what may happen in this country because we have botched the containment part of it so badly. Why have we botched it? Because our government wanted to develop their own tests. They did not accept help from World Health Organization, or WHO couldn't help. I don't know. But all I know is I cannot test anybody at work. Therefore, if I can't do it, none of my colleagues can do it. And the people we should be testing, any community containment efforts are dependent on testing. If you're not testing, you're not containing, because there are so many people who have mild illness with this. So that's where we are. So what should people do? Number one, I don't think you should be buying toilet paper unless you want to die with a clean butt. That's really not going to help. You should have a reasonable amount of supplies. So you should stock up on some foods, medications. You need to talk to your doctors so you can have refills for your medications, so you can avoid doctors' offices. You want to avoid any medical establishment like the plague unless you really need it. Talk to your doctors about telemedicine. See if even your insurance companies can have telemedicine. You can get stuff over through the internet. You can actually see doctors through the internet. You should try to do that for minor illnesses. Avoid contact with people. Avoid large crowds, especially if you have symptoms. You should use hand sanitizer. People clearly have heard that message. You should use it. But this is also airborne, and it does survive on surfaces. So really limiting your exposure to people is essential. And this is very difficult to do now because we don't know where it is. We don't know how affected certain regions are. And without testing, the containment efforts, the quarantine efforts, the self-quarantine, all that stuff is really too difficult. Unless you know that you live in a high incidence area, it's just can seem pointless. And you can't do that indefinitely. You still have to live life. So I hope the government fixes the testing issue, and I hope people take this seriously, because it is serious. And avoid crowds. Accept that your life will change for a little while. Have your essentials ready. Be careful and avoid healthcare establishments, okay? Especially right now. If you have a fever and a cough, but you're otherwise fine, if your symptoms are mild, stay away from your family, stay away from your friends. Self-quarantine. If you're going to cough or sneeze, do so in a tissue, and immediately after that, sanitize your hands. Don't touch surfaces after you do that. Things like that. Coming to an ER now because you just have a mild fever and a cough is not going to help you, and it actually may hurt you, because you may just have a bronchitis or something, and catch this virus in a healthcare environment, because that's where it's going to be. So do yourself a favor, avoid high probability areas such as large crowds and healthcare establishments. So that's all. That is my advice, and that is my understanding of the situation from what I've been experiencing in work and just reading the data coming out of Italy and Washington State and China and so on.